Hello and welcome to today's video on the short-term and long-term complications of type 2 diabetes and how to prevent them. Type 2 diabetes is a chronic condition that affects millions of people worldwide, and managing it can be challenging. One of the biggest concerns for individuals with diabetes is the risk of developing complications that can affect their quality of life and even lead to premature death. In this video, we'll discuss the short-term and long-term complications of type 2 diabetes and provide tips on how to prevent them. So, if you or someone you know is living with type 2 diabetes, keep watching to learn more. Type 2 diabetes is a chronic metabolic disorder that affects millions of people worldwide. It is characterized by high levels of glucose, sugar, in the blood due to either the body's inability to produce insulin or the inability to use it effectively. The disease can lead to a variety of short-term and long-term complications that can affect the patient's quality of life and increase the risk of premature death. However, with proper management, it is possible to prevent or delay the onset of these complications. Short-term complications of type 2 diabetes. 1. Hypoglycemia. Hypoglycemia is a condition where the blood sugar levels drop below normal levels. It can occur when a diabetic patient takes too much insulin or other glucose-lowering medications or skips meals. Symptoms of hypoglycemia include sweating, shakiness, confusion, and weakness. It can be managed by consuming foods or drinks that contain sugar or by taking glucose tablets. 2. Hyperglycemia. Hyperglycemia is a condition where the blood sugar levels rise above normal levels. It can occur due to overeating, not taking enough insulin or other glucose-lowering medications, or experiencing stress or illness. Symptoms of hyperglycemia include frequent urination, excessive thirst, and fatigue. If left untreated, hyperglycemia can lead to diabetic ketoacidosis, a life-threatening condition that requires immediate medical attention. 3. Infections. Diabetic patients are more susceptible to infections than non-diabetic individuals. High levels of glucose in the blood can weaken the immune system, making it harder for the body to fight off infections. Common infections that diabetic patients are at risk of developing include urinary tract infections, skin infections, and gum disease. Long-term complications of type 2 diabetes. 1. Cardiovascular disease. Diabetic patients are at a higher risk of developing cardiovascular disease, such as heart attacks and strokes. High levels of glucose in the blood can damage the blood vessels and increase the risk of developing atherosclerosis, a condition where the arteries become clogged with plaque. 2. Nephropathy. Nephropathy is a condition where the kidneys are damaged due to high levels of glucose in the blood. It can lead to chronic kidney disease and, ultimately, kidney failure. Symptoms of nephropathy include high blood pressure, protein in the urine, and swelling in the legs and feet. 3. Neuropathy. Neuropathy is a condition where the nerves are damaged due to high levels of glucose in the blood. It can lead to numbness, tingling, and pain in the hands and feet, as well as other parts of the body. Neuropathy can also cause digestive problems, such as constipation and diarrhea. How to prevent complications of type 2 diabetes. 1. Maintain healthy blood sugar levels. The most important thing that diabetic patients can do to prevent complications is to maintain healthy blood sugar levels. This can be achieved by following a healthy diet, engaging in regular physical activity, taking medications as prescribed by the doctor, and monitoring blood sugar levels regularly. 2. Control blood pressure and cholesterol levels. Diabetic patients should also aim to control their blood pressure and cholesterol levels, as these are risk factors for cardiovascular disease. This can be achieved through lifestyle modifications, such as following a healthy diet, exercising regularly, and quitting smoking, as well as taking medications as prescribed by the doctor. 3. Get regular checkups. Diabetic patients should also get regular checkups with their healthcare provider to monitor their blood sugar levels and detect any complications early on. They should also receive regular eye exams, foot exams, and kidney function tests. 4. Quit smoking. Smoking increases the risk of developing cardiovascular disease and other complications of diabetes. Therefore, diabetic patients who. Thank you for watching today's video on the short-term and long-term complications of type 2 diabetes and how to prevent them. We hope you found the information helpful and informative. Remember, managing type 2 diabetes is a lifelong journey. But with the right tools and support, it is possible to live a healthy and fulfilling life. If you have any questions or concerns about diabetes, please consult with your healthcare provider. Don't forget to like and subscribe to our channel for more informative videos on health and wellness. Thank you again for watching, and we'll see you in the next one.